The acute medical unit acts as a short stay admissions board. As part of the process of looking after them, we make changes to one or more changes to the medicines on behalf of those patients. So that's why it's important that we get the right information when the patients are admitted to hospital, but also that we get the right information out both to the patient and to the carers and to the general practitioners when they leave hospital.
Repeated audits have shown suboptimal discharge prescriptions and patient understanding of their medicines. So for the past 18 months we had made 6 key improvements in medicines management on the acute medical unit.
On admission, in order to improve patient safety, members of the healthcare team aim to obtain an accurate record of the medicines a patient is taking. To do this, we will talk to patients, GPs, carers and family members.
We ask everyone to use the green bag scheme and bring in all their medications so hospital staff can check what patients use. By using a locally developed trigger tool, we're able to quickly identify patients who have difficulty managing their medicines, for example, partially sighted, elderly patients or people on complex regimens.
We've also built a new pharmacy on our busy acute medical unit to reduce delays in supplying medication for discharge.
Next is a personalised information leaflet, which provides patients with simple written information about their new medicines. Finally, we've introduced a discharge checklist, where nursing staff make sure patients are clear about their medicines. For example, the indications, changes in medications, and common side effects.
I think the medicine checklist is good because it's a good practice. We can go through with it with the patient because at the end of the day it's medicine we're talking about. But I think for the nurses, from the nurses' point of view, we don't have enough time.
In that medicine checklist, it tells us whether we did explain the indication for the medicine, if we did explain the side effects, and if we did explain that such medications, other medications are already been discontinued.
So it's been a great improvement in the discharge summaries with the electronic version. The most useful part for us is the box where you say what medicines have been discontinued and what medicines to continue taking so that we can clearly explain to the patients and update their records.
I'm really pleased that you've been involved in this improvement project. I think it absolutely speaks to so much that the NHS is looking at the moment. One of the things that the board is very interested in is how we maintain patient safety, how we improve quality and how we enhance the patient experience. And it seems to me that this whole drug project does that. It takes people at the most vulnerable time. It helps them to navigate through the changes in the medication. It gets multidisciplinary team really thinking about what's happening with medication. Have we taken the time to explain to the patient so that when the patient goes out, there's not the same chance of readmission because they've had errors with the medication. It also keeps the health community, the GPs, involved with what's been going on. And I think what that allows us to do as an organisation is to become much more productive because we don't have the same risks of readmissions coming in, and that really fits in with the quick challenges that we've got. So here we've got the whole lot. We've got quality, innovation, prevention and productivity, and so I think that's really great. It helps us with our sequin as well because we shouldn't have the same level of readmissions. So I think we need to think about this as a health economy initiative and look at how actually it is saving money, it's improving patient care for our population, but also it's making the team think about things in a different way. It's about them actually recognising that it's good to spend time with the patient and go over what those changes are, because that's time well spent. And I think if we think of it in that way, what we do is embed this change in practice, not just for just now while we're in the initial phase, but for the future. And I think it's got huge potential, so I'm really pleased we're involved with it.